originally noticed, observed and reported by an epidemiologist called David Barker in the 1990s, he reported. And because he found that in a poor area in London, the incidence of these non-communicable diseases were high. And when he went and looked at the birth weights, most of these people had low birth weight. So this was described also as a fetal origin of health and disease, right? So now later they found that not only fetal origin, even other effects during critical periods of life will end up in these non-communicable diseases and other things in later life. So now the fetal origin of health and disease, which was sort of coined in 1990s, now we have shifted to developmental origins of health and disease. Right, so this is a picture which tries to explain this phenomenon. So there is altered maternal nutrition, which results in altered fetal nutrition, and also abnormal placenta and altered uterine blood flow effects, then altered fetal nutrition, and then which adversely affects the organ growth and maturation. So what are the organs? Liver, pancreas, muscle, kidneys, vasculature, and heart. And also it disturbs the normal axis, like the glucocorticoid axis and the hypothalamo-pituitary adrenal axis. So to take the glucocorticoids, they play a major role. They are known as the stress hormones. So when these adverse factors are presented to the baby, produces a lot of glucocorticoids, and that also affects adversely the babies, right? So these, so you can see after this, when these organs are affected, this results in hyperlipidemia, diabetes, hypertension. Now, all these things will other things in later life. So now the fetal origin of health and disease, which was sort of coined in 1990s, now we have shifted to developmental origins of health and disease. Let me explain this diagram to you, flow chart. So here you can see the altered fetal nutrition, which is a result of the altered maternal nutrition as well as the abnormal placental function or abnormal uterine blood flow. So everything that affects that or leads to these things will alter the fetal nutrition. And when the fetal nutrition is altered or affected, it shows changes in the growth and maturation of all these organs, liver, pancreas, muscles, heart and all. So the number of hepatocytes in the liver, number of myocytes in the heart and muscles, and the thickness of the musculature of the blood vessels, number of nephrons, all will be affected even during the fetal life. Right? And another thing is the glucocorticoids, which is a stress hormone. Due to this persistent stress, the glucocorticoid levels are increased, which also adversely affects the baby's growth and maturity. Along with that, the hypothalamo-pituitary adrenal axis also gets affected. So all these things may not show at the time of birth. At the time of birth, baby may be small and without any complications as such. In fact, these babies thrive better because they're already in a bad situation. So when they come out also, they survive better in certain circumstances, right? However, when they grow up, they will end up having all these bad things: hyperlipidemia, diabetes, hypertension, stroke, and coronary heart disease. So again, this is a similar picture. So environmental factors such as undernutrition, stress, psychological and physical stress, infections, everything increases the mother's stress, and then that mother's stress increases her glucocorticoid level, and this 11-beta hydroxysteroid dehydrogenase expression of this enzyme is supposed to denature the glucocorticoid. So, but the stress will increase this so as to maintain a high level of glucocorticoid level. Similarly, exogenous glucocorticoids also can play a role, and all these things increase the baby's stress level, and baby's glucocorticoid level increases. And this, some people say, this is the reason, this is the cause for all these changes which occur in the fetus: growth, organ structure, cell number, gene expression. So, you know, you've heard of epigenetics. These are now currently very commonly used expressions. So genetic expression. So even though everyone has the same genetic, two people may have the same genes, the expression may differ according to the environment. Then the neuroendocrine functions, metabolism, which leads to a higher risk of adult diseases. Right. If you take the postnatal period, yes, genetics plays a role again, and sex, pubertal growth spurts. Then IUGR, as we discussed earlier, people with IUGR, individuals who had an intrauterine growth restriction, may end up as small individuals, right? And now when we speak of IUGR, we speak of symmetrical and asymmetrical. You would remember this, these two terms. Symmetrical means the head and the body, everything is small. Both are small, so that is the symmetry. And asymmetrical means the head growth is maintained and the body is small. Right? So why does this happen? When the nutritional restriction occurs early in pregnancy, the head, body, everything is shrunk, or the number of cells and the size is reduced. However, if the malnutrition occurs later in the fetal life, the head is spared, right? So the body's other organs try to make the head grow, and then the body is compromised. So that is asymmetrical. So when there is an asymmetrical growth restriction, outcome is good because the body shows a catch-up growth later on, and the adult potential is reached. Whereas if it's a symmetrical growth retardation, they end up as small individuals. Then of course we know chromosomal abnormalities, trisomy 21, Turner syndrome, Klinefelter, all these things have changes in height. Actually, Klinefelter shows a tall stature, whereas Down and Turner show small stature. Hormonal hypothyroidism, growth hormone deficiency end up in short individuals. Growth hormone and precocious puberty may show a tall individual in the corresponding peer group. Protein energy malnutrition affect the growths adversely. Obesity shows a higher growth. Micronutrient deficiencies show an effect. Infections, chronic infections in a child will affect its growth negatively. Trauma to certain areas like the growth plates, those things can cause damage and short stature. And a very important thing is a social factor. Socio-economic status by way of poor nutrition. And then psychosocial deprivation, where there is enough food and everything, but there is no love and nurture which the baby needs or the child needs, and that will also adversely affect the growth. Natural resources, certain areas, certain foodstuff may not be available, which may result in the deficiency of that nutrient. Parental education, educated parents may know how to use their limited resources. Even if they are poor, they will know what to give, what is best for their children. Then cultural practices. So certain cultures, certain foods are not accepted, and so certain foods are preferred. So those also can affect the child's nutrition. So in summary, infancy growth is mainly influenced by the nutrition. That is why that nutrition programs are mainly aimed at infancy and early childhood, not for the bigger children. In childhood, hormones play a bigger role, and during puberty, the sex hormones as well as the growth hormone play a role.